the skin is cut and the muscles are separated from the bone. So it is definitely true that spine surgery has received a bad name in the past because of very expensive and it's not affordable. So are there affordable options for patients nowadays? Hi, I'm Dr. Akshay Hari. I'm a consultant neurosurgeon and spine surgeon at Aster CMI Hospital, Hebbar, Bangalore. So what is minimally invasive spine surgery and how does it benefit patients as compared to traditional open spine surgery? So minimally invasive spine surgery is a specialized technique. It is a very new and advanced technique of doing the same spine surgery as traditional open spine surgery, but with the advantage of doing it using small cuts or small incisions. Nowadays, the same surgery which was performed earlier using traditional methods can be done using minimally invasive techniques with incisions as small as 1 centimeter to 2 centimeters. How is it done? This is done by using specialized techniques and specialized instruments with which we can using small tubes or using small endoscopes where the entire procedure can be done. Now, how does it benefit as compared to traditional open surgery? In traditional surgery, the skin is cut and the muscles are separated from the bone, whereas in minimally invasive spine surgeries, this is not done. This minimizes the collateral damages to the muscle, thereby reducing blood loss, reducing infection rates, and so that patients can have better outcomes in terms of early mobilization, early discharge from hospital, and reduced pain. So most people fear spine surgery. How safe is it today using the latest advanced techniques? So it is definitely true that spine surgery has received a bad name in the past because of people fearing spine surgery. So that was then, but nowadays with advanced technology and advanced techniques such as minimally invasive spinal techniques, spine surgery can be performed safely. So there are newer advances like neuro navigation, newer advances like intraoperative neuro monitoring, as well as the entire procedure being done using minimally invasive advanced techniques. This improves the safety and precision as well as accuracy of performing surgery, thereby improving the overall safety profile for the patient and improving patient outcomes. People often think that spine surgery is very expensive and it's not affordable. So are there affordable options for patients nowadays? Well, I don't think that spine surgery is not really affordable. Nowadays, with improved advanced techniques, in fact, patients actually spend lesser time in the hospital, thereby the overall costs of hospital stay is actually reduced. And with the help of advanced techniques, patients can get mobilized early, and so their requirement of leave and absence from work is also reduced. So these are the considerations that one must have when one considers about affordability. How has advanced spine care changed the way we treat back and spine problems? So nowadays, I think the biggest advancement is the ability to personalize treatment based on the patient's requirement. So nowadays, patients' requirements may change. So everybody need not require the same kind of approach. Patients' treatments can range from simple treatments like physiotherapy, exercises, sometimes even percutaneous pain procedures like injections, and of course, minimally invasive spine surgery wherever it is necessary. I think this is the biggest advancement that has happened the way we treat patients nowadays. So even with advanced techniques and technology using navigation technology, neuro monitoring, sometimes even robotics nowadays is coming up in a big way. And I think these are the advancements which are taking place nowadays to treat back and spine problems. So what is endoscopic spinal surgery and how does it benefit patients and in which kind of conditions can it be used? So endoscopic spine surgery is a very advanced minimally invasive spinal surgical technique. It uses a specialized camera which is used through a very small port, often less than a centimeter, and using specialized instruments that are used through the endoscope itself, the surgery can be performed. Now this is extremely effective in patients having slip disc, sciatica, or nerve compression to decompress the nerve. And the beauty is that with endoscopic spinal procedures, the safety is improved and patients can walk the same day and even discharge the same day or the next day after spine surgery. So what are percutaneous pain procedures and how does that help with patients suffering from chronic back pain? So nowadays many patients have chronic back pain. So not everybody requires surgery. So percutaneous pain procedures is a procedure where we using needles and X-ray guidance, we inject special chemicals, sometimes steroids, sometimes local anesthetic agents. These can be injected to the affected nerve around the affected nerve and especially around the spinal joints. This relieves pain in most patients suffering from chronic back pain, which has not improved with medications, physiotherapy, or exercises. Patients can get back to their normal life soon after the procedure. How does slip disc or sciatica affect the daily life, and how can it be treated? Does it always need surgery? So slip disc and sciatica is becoming very common nowadays. So what is it? What exactly is it? So sciatica is when pain radiates from the back to the leg. So that's when it's called sciatica. So slip disc often can compress the nerves, which causes sciatica. So not always surgery is necessary. In most cases, these kind of conditions can be treated with physiotherapy, exercises, medications, and sometimes even nerve root injections. Surgery is only necessary when there is a significant pain which is not reducing with conservative treatment more than 4 to 6 weeks, or when there is numbness or weakness of the legs. And even in such situations when surgery is actually necessary, minimally invasive surgeries like endoscopic surgeries or keyhole tubular surgeries can provide significant relief, and patients can walk home the same day or the next day pain-free. Lifestyle is key. It is the most important consideration one must have when recovering from spine surgery or from any sort of spinal treatment. So it is very important to maintain good posture. It is very important to have a daily exercise routine, and it is also important to prevent the back strain or the spinal strain. So how do we do that? We should maintain a proper posture, whether we are sitting, whether we are standing, or whatever we are doing in our daily life. That is number one. Number two, we should have a good exercise program, whether it is physiotherapy, whether it is any yoga or any other form of exercises. We should remember to keep ourselves active most of the time. The third thing is frequent change of posture. We should remember that even if you are sitting for long hours, we should make sure that we should not sit in the same posture for more than half an hour. So remember, you take care of your spine, and your spine will definitely take care of you. I'm available for both in-person consultation as well as video consultation on the Aster Health app.